Wondering how vein disease is diagnosed? Let's walk through what happens during your consultation here with us. So if you've come to our office referred by another physician or maybe a friend who's had treatment with us, or maybe yourself, you're struggling with your legs, you don't like how they feel and you found us, we're going to see you on an initial evaluation to talk about what's going on. The things that we want to know about are essentially your symptoms, and most people will have something like a sensation of fatigue, heaviness, or aching, usually at the end of the day. They may have some swelling, they may have some evidence of broken capillaries, little spider veins or varicose veins, and they may have other symptoms that are not as typical, like cramps or restlessness at night, itchy legs. All of those things are important because those are sort of typical symptoms of vein disease. Now, we do have some patients that actually refer that they don't feel anything, and a lot of times that can happen in people who have had disease for such a long time that those symptoms that are very mild or minor have become normal to them. A lot of times we have patients that have gone through treatment, and after their treatment they feel that their legs are lighter, they don't feel tired anymore, or they've actually then gone down on their shoe size, believe it or not. So you may not necessarily be aware that you have symptoms, again, because they are in general so mild in most cases, especially at the beginning. So we'll go over your history, we'll do a physical examination, we want to check your legs, we want to see the veins that you may or may not notice, because that will give us signs or give us clues as to where the disease may be coming from. We'll definitely want to know about your medical history, if you're on any medications such as hormone replacement or oral contraceptives or any type of hormonal replacement that can affect your veins, and other types of medical illnesses that may be important. We'll definitely want to know about your family history, because that is definitely one of the biggest risk factors for vein disease. It definitely runs in the family. Their mom, their dad, their grandparents, somebody in the family had them, their sisters, their brothers, and that part is important as well. But essentially, once we're done with your history and your physical exam, really what's going to tell us what's happening internally in your legs is the ultrasound. An ultrasound is an exam that most people are familiar with, and a lot of you may have even had one in the hospital when they're checking for blood clots or DVTs, things like that. The ultrasound that we do here at Lumina is actually a more specialized test. It's a functional test where we can actually see the direction of the flow of the blood in your legs. We can figure out if it's going in the right direction from your feet and your legs back up to your heart, or if it's actually going in the wrong direction. And the other thing that we will be looking at is the size of the veins. We know what a normal vein should be in terms of its diameter, and we know that as vein disease progresses and this congestion increases over time, veins tend to get larger and dilate, much like balloons. So having dilated veins is also an indirect sign of having vein disease. We will also be able to trace your specific varicose veins, which, by the way, will never be the same as the person next to you. We need to figure out where they're coming from, because there's multiple veins that can actually have this issue. Thankfully, most times, the veins that are affected in venous insufficiency or varicose veins are veins that are not important. They're not essential. Think about your appendix or your gallbladder. We're all born with one, but if we do get appendicitis, we go for surgery, they take that organ out and we're fine. The veins that tend to get affected in this condition are actually like the appendix. They're not essential. The really important veins, the ones that I like to call the highways during consultation, those ones tend to be perfectly fine on most people till we make it to old age, but we'll still look at them because we want to make sure that they are in tip-top shape. Once we have that ultrasound, we have all of the pieces that we need. Some people, a very small fraction of patients, may need some extra workup if there's other things that make us think of other conditions, but that's very unlikely in most patients. And again, all of the evaluation is done right here in the office, and we'll be ready to move to next steps as far as recommendation for treatment once we have all of that information together.